Madeline Leininger was born on July 13, 1925 in Sutton, Nebraska. She grew up on her father's farm in Harvard, Nebraska, along with her mother and siblings. Leininger said that her late Aunt Margaret inspired her to become a nurse with the belief that caring for someone when they're sick is a wonderful thing. When she got old enough, Leininger and her sister got their bachelorette degree from St. Anthony School of Nursing in Denver, Colorado. Leininger then got her academic degree from Mount St. Scholastica. In order to pay for their academic degree, Leininger and her sister worked at the Navy Depot, where she was one of the first women supervisors. Leininger graduated with her credentials of RN, PhD, LHD, FRCA, and FAAN. Leininger believed in 1950 that healthcare should be culturally competent by 2010. She passed August 10, 2012. Madeline Leininger played a major role in correlating nursing and anthropology. The theory of transcultural nursing was established in 1961. Leininger defined transcultural nursing as a substantive area of study and practice focused on comparative culture, care, values, beliefs, and practices of individuals or groups of similar or different cultures, with the goal of providing cultural, specific, and universal nursing care practices and promoting health and well-being, or to help people to face unfavorable human conditions, illnesses, or death in culturally meaningful ways. The transcultural nursing theory is first seen in Leininger's book of Culture, Care, Diversity, and Universality. The theory was further developed in Leininger's book Transcultural Nursing in 1995. Leininger's most current edition was published in 2002 and contained theory-based research and made the transcultural nursing theory applicable. Overall, Leininger wanted the transcultural nursing theory to perceive and maintain the patient's cultural health practices, accommodate and adapt or adjust healthcare practice, and repattern or restruct some cultural practices.
Transcultural nursing can apply to nursing education in a few ways. Nursing education is the way in which nurses teach patients and help them to become more informed about their diagnosis or treatment and help to care for not only the patient's physical needs, but also their patient's cultural needs. As a recap, the Fundamentals book defines transcultural nursing as a field of nursing founded by Madeline Leininger, in which the nurse transcends ethnocentricity and practices nursing in other cultural environments. Ethnocentricity is the belief that one's culture is superior to that of another. So the definition is saying that the nurse will accept that other cultures are neither better nor worse than theirs, therefore it should not affect the type of care they are given. One example of getting to experience transcultural nursing and nursing education is mission trips. The ACU School of Nursing provides a few opportunities to get to experience what it is like to be a nurse in other cultures, not just in America, but around the world. Reading the impact it had on the different students in the last class, many of them talked about how different it was getting to be a nurse and help out in other countries. Some of them got to experience things they would never have been able to see here in America, even after they became an experienced nurse. They talked about how in other countries, maybe the nurse would do more education than most of the doctors because many times the patients would tell them things and not the doctor because they were not as comfortable speaking with the doctor. While this is a kind of extreme example, every day the class goes to clinical, people are interacting with people from different cultures and different life experiences. So just by interacting with the different patients we meet at clinicals every week, we are getting to interact with people of a different background and letting go of what we think is right and best as far as cultures go. When nurses interact with those of different cultural preferences in regards to teaching and education, certain cultures prefer to talk to people at a closer or farther distance than the nurse may be comfortable with. But it is all a part of doing what the patient needs and what will make them feel more comfortable interacting and asking questions of the nurse. The same goes for eye contact and gender preferences. It is all a matter of putting the patient first and making sure they are well educated.
Madeline Leininger was considered not only a theorist but a researcher. She used what she observed while working as a nurse, such as traditional psychiatric nursing interventions that did not effectively address the needs of children from differing cultural backgrounds, to develop the culture and care theory. Leininger developed this theory to help nurses provide care that is more holistic to their patients. This theory has been used as a basis for further research. In a study conducted by S. Mixer, they identified themes that relate to the culture and care theory. The first theme is that an integral part of care is rooted in a person's religious beliefs and practices, as well as their personal values. Another theme identified by Mixer was that nurses needed to be able to be mentors for students and show how to provide cultural as well as professional care. In addition, this study found that providing cultural care is influenced by people's worldview, factors involved in social structure, and the environment. Mixer states that Leininger's theory has led to the discovery of 175 care constructs from 58 cultures. This study used 6 care constructs identified by Leininger that included respect, praying with, listening, collective care, reciprocal care, and surveillance care. In research led by Leininger, she states that the use of the transcultural care theory has led to nurses who are more mindful to cultural care for patients. Research conducted has shown that this theory helps nurses and nursing students acknowledge differences and similarities within cultures, which will encourage a more culturally diverse nursing workforce. Although there have been many studies that use her theory as a basis in their research, many of the findings still need to be applied to practice, education, and administration. An example of how one could apply this theory to research would be to be mindful when sending out research surveys. You want to make sure that your survey doesn't have bias and doesn't imply stereotypes to different cultures. By doing this, you will be able to obtain more accurate results without applying judgment to a particular group of people.